Welcome back to Wisdom and Life. Thank you so much for the support that you are showing me. Thank you for subscribing. Thank you for watching. Thank you for sharing. Thank you for commenting. And if you're watching and you've not subscribed, please do so. It is going a long, long way. Today, I want us to look at treatment adherence. And basically, chronic illness comes with a lot of medication that you have to take every day for a long period of time. And when we talk about chronic illness or non-communicable illness, we are looking at diseases like hypertension, diabetes, sickle cell, lupus, cancer, and so forth and so forth. We have even communicable disease that you have to take medication every day for a long period of time. For example, in tuberculosis, you take medication for 6 months or even beyond, depending on the type of TB that you have. If it's drug resistance, then it means that you're supposed to take for a longer period of time. HIV, you are taking medication, ARVs every day. Basically, these are diseases that you will need to take medication for them every other day. And there was a time I was doing something on adherence in passing when we were talking about patients' rights. And I remember talking about something like TB, which spreads from one person to another. So you have to take medication, otherwise you become a risk to the rest of the population. But sometimes, like now, I know things like even antibiotics, adherence is a challenge, and that is why in the recent past we are talking about disease resistance, drug resistance, because people are not able to comply, or they're not able to take as they are supposed to. When it comes to chronic illness or illness that is life-threatening and you depend on that drug maybe for you to survive, then there are quite a number of dynamics that come into play. When we talk about non-adherence, one could be unintentional and the other one could be intentional. When we talk about intentional non-adherence, it is when a patient decides that they're not going to take this medication according to the doctor's prescription. Maybe because they have not understood as to why they're supposed to take. Another thing, maybe their beliefs. Another thing, maybe just their attitude, and a lot of things surrounding intentionality. Because human beings, we were born with the gift of choice. You choose what you want to do with your life. You choose what you think is best for you in the life. And then we have unintentional non-adherence. Unintentional non-adherence is when, for example, you forget to take your medication. It could be you don't have even the money to get that medication. Sometimes the treatment regimes may be a bit complex. You do not understand what times you are supposed to take, or too many medications. Sometimes you get a mix-up of which drug is supposed to be taken at what time and at what time. So there are things that will contribute for you not to take your medications. So I want us to look at how will you be able to adhere to medication. As a cancer patient, I know this is the 3rd year I'm on tamoxifen. And I won't sit here and lie to you that I take this medication faithfully, sacrificially. I take it every day. The days I forget, especially when I travel, I forget to them back in the house. Sometimes I'm carrying them, but because it's not within my routine, I even forget to swallow them. Sometimes you are taking the last pill and you remember I have not made an order for the next refill. So meaning that maybe the following day or 2 days we'll have to skip the medication. So if we can be truthful to ourselves, then the issue of compliance or adherence is an issue that we can't just sit and leave it at that. Otherwise, we will not be talking about multiple drug resistance in antibiotics. We will not be talking about relapses. We will not be talking about malignancies in terms of maybe hypertension, because people are adhering to medication, meaning that their disease progress is slowed or it's maintained. Especially the maintenance doses, sometimes we think that we are okay, so we just say, I don't need to continue taking this medication. So when you think that you are okay, or you think that I do not have the symptoms, or you think that I'm having these side effects and so I don't need this medication, then that is where the challenge lies. So let's talk about adherence today. About some of the tips that will help you with adherence, especially when you understand that your medication is supposed to take longer. Number one tip is acceptance. Acceptance, sometimes we have seen patients whose disease progression has continued because they were in denial for a very long period of time. For example, you were diagnosed with cancer stage 2. Then, because you were in denial and you didn't want to take up the medication schedules, then you stay for a long period of time. By the time you are coming, maybe you have dealt with your denial, it is in stage 3 or it is in stage 4. So you need to work on acceptance. Acceptance is, yes, as human beings, we have our seasons of denial, of bargaining, until you reach that point of closure and say, yes, this is something that I have to put up with, maybe for the rest of my life. Like for hypertension, diabetes, asthma, these diseases that we've just mentioned, you need medication each and every day. The moment you begin remaining in denial, the moment you do not accept that that is your condition at that particular point, that is when you will begin to struggle with adherence. Because then we'll be talking of the times that you are telling yourself, no, no, maybe I am healed. No, maybe I'm better because my symptoms have improved. Then the other thing that you need to do is be grateful. Live a life of gratitude. Because how many people with your disease are still alive? There are people you can point your finger at and say, so and so died because of this disease, so and so died because of this same disease that I have. But for you, for God to have spared your life, for example, for me, cancer, how many people have died because of cancer? Why has God spared my life? Then if I have gratitude, then I should be able to take my medication as scheduled or as prescribed by the doctor every single day. The doctor, the treatment I'm taking right now, I'm supposed to take it for 5 years, and the doctor still says that after 5 years, if they realize that I need to take for more 5 years, then that is what they'll prescribe. Imagine if I did not enter into acceptance, then there'll be a lot of non-adherence if I have not accepted that that is my situation, that is what needs to happen with me. Then the part of gratefulness is when you realize that you are alive and other people with the same condition, even maybe a lesser grade, have died. So you need to live your life with gratitude by taking those medications as they have been prescribed. Number 3, you also need to understand why the treatment is important to you. The doctor will not tell you or prescribe for you a treatment that is not important to you. It must be playing a role in maybe keeping you alive, or lessening your symptoms, or relieving your symptoms, or making you feel better So the doctor will prescribe that. So you need to understand, why am I taking this treatment? Why is it this treatment is important to me? Then number 4, get as much knowledge as you can about the medication that you're, apart from just knowing it is important to you for these reasons, you also need to understand what is this medication. In the video that we have done about patients' right, you need to understand the drugs that you are taking. Don't come to the hospital and say that the pills that are blue in nature or pink in color. No, no, no. You need to understand that this medication it looks like this, it is called like this, these are the side effects. And then once you understand, then you'll be able to manage as you should. Then number 5, you need to learn how to remind yourself. Just whatever works for you. You can put reminders, you can put maybe on your phone, you can write sticky notes, you can whatever, you can tell a friend to remind you your timings for medication. Then just get someone to be accountable, or accountability partner for that matter, so that every day you are able to remember the timings for your medication and take as they have been prescribed. Another thing you can do is that if you are a frequent traveler like myself, you can keep some of your medications in your traveling pack. It could be a challenge if you travel frequently, that is. It's not if you travel once in a while, because the other challenge that you may have for you to for your medication maybe in your bag is that they may expire and you don't know. Only do that if you are traveling frequently. So basically for travelers. Then number 7 is remember to attend your doctor's appointments. When you attend the doctor's appointment, you will be able to give him your challenges, or her your challenges, your side effects, and maybe, who knows, they can change the medication. There are always options. What are some of the consequences of non-adherence to medication? Because every omission, every commission has a consequence to it. So for drug non-adherence, one of the first things I know is medication wastage. Because when you do not take medication, it has its lifespan in terms of expiry, in terms of if you have diluted, maybe it's a drug that needed to have been diluted for this number of days. Of course, after those number of days, you have to discard. So medication wastage will be comes number 1. Then disease progression, as I've already mentioned, is that medication is supposed to help you. So when you fail to take that medication, and they shall have a time that is supposed to be concentrated in the blood system or in the body system. So when you don't do that, you are encouraging disease progression. If you missed your medication for pressure in the morning, then of course there's no way your blood pressure will go down. If you missed your insulin, if you're a diabetic patient, there's no way your blood sugar will be okay. If you missed your inhaler, maybe you forgot it at home, you go into an attack, maybe it may progress to an an asthmaticus situation. If you missed your medication, we are simply saying that you are causing disease progression. And when disease gets worse, then it means different interventions have to now be devised. Who knows, your treatment, by just taking that medication, you may avoid maybe surgery. Who knows, by taking that medication, you may avoid maybe death. Who knows? So disease progression, if you do not adhere to treatment. Then we also mentioned about drug resistance. When you fail to take medication, you take today, you fail to take tomorrow, the following day you take, that medication will be of no effect. You will start having drug resistance, meaning that you either change your treatment to something else, so that but make sure that you comply, or make sure you adhere. Then of course this leads to lower quality of life, and this also means that frequent hospital visits. So basically we are saying that if you do not adhere to medication as prescribed, then it means that you are doing more harm to yourself than doing good to yourself. There is also something that I feel I need to talk about, especially for us Christians. Sometimes I always tell people, I'm myself a born again Christian. Sometimes we assume that we are healed and we do not comply to medication as it is. Sometimes we even go for prayers, and the pastors, quote unquote, they'll tell you if you do not take, if you are still taking that medication, then you do not have enough faith. That is not the case. God is the person who invented medicine. God is the person who has given knowledge to these doctors. And when you fail to use that understanding and that knowledge, then you are a man devoid of wisdom. So thank you so much for watching today's episode. And I hope that this information will help you for yourself and for that patient of yours that you have in the house, as you help them on the journey of adherence. Please subscribe if you're watching without subscribing. See you in the next video.